Hello, my name is Kayla Van. I am a third-year undergraduate psychology student at Virginia Commonwealth University. For the 2023 Diversifying Scholarship Research Conference at the University of Virginia, I will be doing a presentation examining a 5-year trend of the declining quality of healthcare among Asian children with special healthcare needs from 2016 to 2020. To begin, there is a lack of research that looks into child health disparities. This makes this area very important to study in health inequality research. 1 in 5 families in the United States has a child with special healthcare needs. Children with special healthcare needs tend to have a higher rate of health conditions and uses health services more often than their developing peers. Over a third of families with a child with special healthcare needs report issues, delays, and dissatisfaction receiving community-based services. Looking closely into children in minority groups, they also experience significant inequalities in healthcare quality, access, satisfaction, and outcomes compared to white children with special healthcare needs and without disabilities. With all of this in mind, various studies have found significant racial disparities in the quality of healthcare among children with special healthcare needs, including among Asian families. The objective of the study is to examine if disparities in healthcare quality among Asian children with special healthcare needs have improved on a 5-year trend. This study used 2016 to 2020 data from the National Survey of Children's Health provided by the Data Resource Center for Child and Adolescent Health. A total of about 27,000 samples of non-Hispanic Asian and non-Hispanic white children's special healthcare needs were used in the study. 5 criteria of healthcare quality were examined. We looked to see if 1, doctors spent enough time with the children, 2, providers listened carefully to the children's parents, 3, providers showed sensitivity to the children's families' values and customs, 4, doctors provided information that was specific to the parents' concerns, and 5, providers helped the parents feel like partners in their child's care. For data analysis, we use R, a programming software, to run descriptive statistics and create a faceted line plot showing a 5-year trend graph of each healthcare outcome across each group. The next 2 slides will feature our descriptive statistics. Overall, there were significant differences between non-Hispanic Asian and non-Hispanic white families with children with special healthcare needs. Asians were significantly more likely to speak a language that was other than English. Asian families were more likely to have adult education that was less than high school and have a college degree or higher. Asian families were more likely to have a child with special healthcare needs with functional limitations and above routine use of medical care. They were also less likely to have medication and above routine use of medical care. There was no statistical differences present in the complexity of children's special healthcare needs between Asian and white families, as the percentages between the 2 races are the same when compared. Asian families were more likely to say that they had parents that were born outside of the United States. In this slide, we compare the quality of healthcare received by Asian and white children with special healthcare needs. We can see from all across the board that Asian parents of children with special healthcare needs were less likely to say that doctors always spent enough time with their child, listened carefully to their concerns, was sensitive to the family's values and customs, gave information that was relevant to their concerns, and made them feel like a partner in their child's care. The responses were mostly usually, or sometimes, or never. This slide shows an overview of a 5-year trend in each healthcare outcome across each group. We can see that non-Hispanic Asians have a lower trend line across all 5 criteria of healthcare qualities compared to non-Hispanic whites. Also, trend analysis indicated a significant decline in the quality of care among Asian families beginning in 2019 and persisting into 2020. From what we saw from the past 3 slides, results suggest that Asian non-Hispanic parents of children with special healthcare needs continue to report significant disparities in the quality of healthcare that their child receives. Non-cultural barriers such as language, cost, and lack of knowledge of resources that are available can contribute to the low usage of Asians obtaining the care that they need. To explain the significant drop in 2019 that we saw earlier, current events from that time could be a reason to explain the notable decrease in healthcare quality among Asians. One of the events could be an increase in anti-Asian hate crimes. Another event that could explain the sudden drop in healthcare quality could be political affairs that happened at the time. Overall, not much research has been done to explain the reason behind the substantial drop in 2019. Further research should be done to look into this. We have come across a few limitations in this study. First, the language of the surveys given to collect responses from parents and/or guardians were limited. This affected the number of sample sizes acquired from the Asian population. Second, the study did not investigate other factors such as gender, acculturation, specific languages that the participation population spoke besides English, and immigrant origin. Third, the study compiled multiple datasets from 5 years into one. This action could potentially impact the uttermost accuracy of analyses. Fourth, the sample sizes of Asian children's special healthcare needs were much smaller when compared to white children's special healthcare needs. This issue can impact the level of significance to some of the data that were presented. Lastly, the parent or guardian reported data of children's special healthcare needs could be flawed, as cultural distinctions could affect their survey responses and how they view their children's quality of care. Everyone has their own way of interpreting what they see and feel, so how parents or guardians respond to the questions in the survey could sometimes not reflect the same opinions as the child. The findings found in our study are very important to make the first step in creating an equitable environment for all races in obtaining healthcare. Future studies should continue examining the quality of healthcare along with exploring the quality of healthcare received by Asian children's special healthcare needs. Outside of research, people in the community can also contribute to creating an accessible and equitable environment for healthcare. Local and national policies should focus on ways to implement and enforce affordable and equitable healthcare for everyone, especially for individuals and children in minority groups. Hospitals and clinics should have accommodations for patients who speak limited English, such as providing a translator during appointments. Furthermore, other individuals and groups in the community can develop ways to educate about the healthcare system and resources that are available for use. We can have community lessons, whether in person at a community center or online, where someone can teach about how to navigate the healthcare system in their native language. If that's not possible, then we can create and maintain a website in multiple languages or have flyers posted at distinct ethnic grocery stores in their native language, which could provide information on how to access specific healthcare resources that are available. We can also establish and support cultural brokers and community navigators to support community members in navigating the healthcare system, provide support and advocacy. Here are all the references I mentioned throughout the presentation. With that is all I have for my presentation. Thank you so much for listening to my talk. If you come across any questions or thoughts in the future, please feel free to reach out to me. I will be more than happy to chat about the study and ways to improve it. Thank you again and have a great rest of your day.